Let's measure subtalar joint, inversion, and eversion. So we'll start with inversion. We'll measure this passively. Subtalar joint is a triplanar joint, so there are coupled motions that occur. That's pronation or supination and pronation. The three planes of motion that make up pronation and supination are going to be DorsEvAB and iPad. So supination is iPad. It's going to be inversion, plantarflexion, and adduction. And then DorsEvAB, dorsiflexion, eversion, and abduction is what is known as pronation. So with this subtalar joint inversion and eversion range of motion test, we need to allow all three planes of motion to occur to assure we're at the end of the physiological range of the subtalar joint. Although with this measurement, we're just measuring the frontal plane component, which would be inversion or eversion. So let's measure inversion, allowing those other two motions to occur, plantarflexion and adduction. We're going to spring against the barrier, assess end feel, and then alignment of our goniometer will be the posterior midline of the leg. And then we're also going to bisect the posterior aspect of the calcaneus and align our indicator or distal arm with that retrocalcaneal midline. So there's inversion. Eversion, again, we're going to allow those other two coupled motions to occur at the subtalar joint, dorsiflexion and abduction or DorsEvAB. Going to spring against the barrier, maintain that end range position. Proximal arm is lined up with the posterior midline of the leg, and then the distal indicator arm is aligned with the posterior midline of the calcaneus.